Hello, this is Dr. Irene Hausinger, and this is the intro video for CDP 401, Treatment of Addiction Online, Summer 2019. Woohoo! All right, we're going to go over the syllabus in a minute. You have two texts for this class. This is In the Realm of Hungry Ghosts by Dr. Gabor Mate. The first book that we're going to be looking at is Substance Abuse Counseling by Lewis, Dana, and Blevins. It's a smaller book. The print is very small, but the chapters are jam-packed, but not overwhelming. There's a lot of vignettes, and at the end of each chapter, there are some great resources. So those two books, we'll be using the Ghost book later on in the semester. I dropped my syllabus. Okay. So our course description for this class is grounded in evidence-based clinical skills. Students will be prepared to screen, assess, diagnose, and treat substance abuse disorders according to the National Association of Alcoholism and Drug Abuse Counselors, NADAC, professional and ethical standards. Students will learn the appropriate treatment modalities for individuals, families, and groups, and all the required documentation for the treatment process. The American Society of Addiction Medicine, ASAM, criteria will be the foundation for addiction placement, continued care, and transfer discharge. Students will also examine the intersectionality of class, race, culture, and spirituality and its implication on treatment. Co-occurring disorders, trauma, and HIV/AIDS brief risk intervention are also addressed. Specifically, at the end of this class, students will apply individual, family, and group counseling methods for chemical dependency in different community and clinical settings. Apply the understanding of addiction placement, continuing care, and discharge criteria, including the ASAM criteria, to different clinical situations and scenarios. Be familiar with the documentation of screening, intake assessment, treatment plan, clinical reports, clinical progress notes, discharge summaries, and other client-related data. Understand and apply the implication of class, race, ethnicity, culture, and religion, spirituality on treatment in different clinical situations and scenarios. Gain in-depth knowledge of chemical dependency treatment planning, treatment, relapse prevention, and evaluation with special focus on special populations such as adolescents and veterans. Explore and identify different modality and messaging of client, family, and community education. Become familiar with community resources and the referral process. Understand the process of chemical dependency case management and all the unique rules, expectations, and needs of this population. Complete the SAMHSA certificate. That is no longer available, so we'll be doing a different prevention. So this is still in the course description, but SAMHSA discontinued that, so we have an alternate assignment for that. And complete the HIV brief risk intervention for high-risk clients. Okay. So as this is an online class, our structure runs Monday through Sunday. So a new module will open every Monday, and then unless otherwise specified, all of your due dates will be Sunday by 11:59 p.m. We will be using our phones or computers for the voice app, the walkie-talkie app Voxer, which allows us to have a oral discussion, a vocal discussion through messages. So it's very much going to be like a class discussion, and you can listen to everybody's responses and then record that yourself and listen. If you're a 3 a.m. person, you can do that 3 a.m. and then the rest of us can listen at 8 a.m. or whatever it might be. So it's going to allow us the ability to have a class-like discussion without time frame limitations. The only time frame limitation is that I would like you to have your initial discussion by Wednesday, and then the following Sunday, that Sunday is when it stops, and then Monday is when a new discussion will start. Okay, all right. It is a jam-packed semester, cramming 15 and a half, 16 weeks worth of materials into 8 weeks, so please do your best not to fall behind. The chapters are relatively short, but you do have a lot of supplemental things every week. So in general, you're going to have our Voxer discussion. There's going to be a weekly practice/reflection that you will submit in that space and Moodle. And then you have several different assignments. So we're going to go over that, our course outlines and assignments. So the first week, you have chapters 1 and 2. 1 is Intro to Treatment, and 2 is a review of drugs and substances. We're not going to spend a lot of time on that. If you had 400, which you should have by now as a prereq, you'd be familiar with some of that. So we're just going to go over the drug classifications and things of that nature. Your first assignment is due the second week, and that's a brief risk intervention video due June 9th. And what that means is you're going to be interviewing somebody and taking a video. It should be about 5 to 10 minutes, and you're going to, in a compassionate counselor manner, using good attending behavior, go over the HIV brief risk intervention questionnaire with them, give them education materials, assess their risk level, and see if you can offer them any resources and some education. Okay, and there's more, there will be more on that in this week's module. The second week, motivational interviewing, screening, and assessment, and we're going to be looking at assessment, and you will be doing assessments on each other. I will give you a biography and a use history, and then you will be interviewing somebody and doing an assessment. Okay. The third week, your first DAP note is due, so that's going to look like, how do I make a chart note? What would that look like in a clinical setting? And that week, we're going to be going over the counseling, relationship, and group counseling. Week 4, we're at the midterm point already, and that covers chapters 7 and 8, maintaining change, relapse prevention, and working with families. And then you're going to be starting the Ghost book, which is largely a storybook about Dr. Mattei and his experiences working in the district in Vancouver where the first clean injection site was, Vancouver Insight. Okay, highly controversial. We'll be talking about that later on and showing you some statistics and what the program does. Okay. Week 5, your assessment write-up and interpretive summary is due. And then we're going to be looking at successful service programs and prevention. You have chapter 9, chapter 10 in the SAC book, and then Ghosts 2 and 3 and an appendix in the SAC book as well. Week 6, service coordination and referral, and your second DAP note is due. Ghosts 4 and 5. Week 7, special populations. There are a lot of online Moodle resources for that week, a lot of resources for you. And then your resource binder is due July 14th, and I'll talk about that in a minute. And then last week, we're going to be looking at alternative practices, okay, and recovery alternatives, and that's Ghost Part 7. Okay, so let's go over your assignments. So every week you'll be having your Voxer discussion, which is your class time, and you will submit your personal reflection / practice. Every week you'll have a different skill to practice or a reflection. The ASAM assessment is going to be an actual clinical assessment. The HIV brief risk intervention video, all of this is on the last page of your syllabus. The instructions are there. Your community resource binder, and you might want to start on it now, is going to be a binder for chemical dependency resources for the community. And you're going to create a client-centered resource binder geared towards the community in which you live in. You could expand that if you want. And the goal of this is to increase awareness of local programs, agencies, and resources for those impacted by substance use, including individuals, families, veterans, and those with co-occurring diagnosis. So it's a 2-part binder. There'll be 10 sections. 5 sections are community resources. The other 5 sections are things that you would use as a case manager / counselor. It's not uncommon for somebody to call out sick and then you have to cover their group. Well, what do I do if I've never covered that group before? Well, you have the binder, so you're already armed. So you'll have group topics on different subjects that I'm going to give you, like communication, the Duluth Power and Control Wheels, things like that. So you'll be ready. And a lot of what we do as counselors and case managers is teaching skills to clients one-on-one. So you'll have these worksheets and things already prepared, because once you start working, you won't have the time to do those. So that is the intro to the class. My office hours are whenever you need me. We can do Skype, we can do FaceTime, we can do a phone call. My phone number is in the syllabus. Respect the syllabus, respect the phone number. And there we go. So as you can see, I'm in my animal room. I have a variety of animals. My parrot is in this room. She's hiding right now because she's laying eggs and being a weirdo. So if you hear weird noises, it's because my animals are probably trying to get to me. So anyways, I look forward to seeing you online. Dr. Hausinger out.